there's a few options to replacing hormones. The most common options are injectables, um, creams, right? Topical medications, so like creams, and then patches.
Okay.
From all of those alternatives, which I've done all of them, I've treated patients for years in all of them, right? I feel based on science, studies, and how the patients are compliant and how they feel, that pellet therapy is the best and most optimal way to optimize your hormones. If you don't know what pellet therapy is, so pellet therapy is kind of like a natural hormone replacement method where it looks like a little grain of rice that is inserted into the hip, so the fat where the hip area is. And the way that it works is your own blood vessels are going to pull from that pellet and are going to absorb that medication, whether it is testosterone or estrogen. They're going to absorb that medicine, and based on your heart rate, it's going to start giving you what you need for your own body. The cool thing about this is you don't have to inject yourself every 5 days. You don't have to apply annoying, creams twice a day. You don't have to put patches. I always tell patients the skin is here as a barrier. It's to protect our insides and to try for things not to get into our bodies. So yes, you can do a patch, you can do a cream, it's going to work, but to bring your levels to the optimal levels that we really want, I've never seen it. It doesn't happen.
I've never even heard of creams. So where
Yeah.
would you apply the creams?
So some creams, for example, testosterone is replaced by a cream that's called androgel, for example. Androgel, free commercial. So androgel, for example, it's a pump, and you use that pump and you can apply it on your arms. You can apply it on your back, your abdomen. The problem with that is you have to wait until it dries. It's not always absorbed the best. You can do cross contamination where you have to clean your hands very well because you can contaminate others if you don't, right? Because you're passing the medicine to other people.
Oh my God.
So yes, a lot of people know that. But
yeah, wait. So okay, guys, if anyone's giving you for a hug, everyone's like, did you wash your hands thoroughly? Yes, I did. Okay. Oh my God, that's so funny. That's so crazy. I mean, not funny, but that's crazy.
So I used to tell my patients back in the day, a long time ago, when I used to prescribe it, I would say, wear some gloves, apply the cream, and then just take them off and throw them out. That's the best way. The problem is if patients are applying creams and then they go to the gym,
it'll sweat out.
Right. It's just annoying. And same with females. Like some females would use estrogen creams, and it's just they start getting into like, okay, I can't go to the gym. Let me put it on after the gym, but then okay, it's close to it took me maybe 2 hours, so it's already 2 p.m. and I have to apply it again at 6 p.m. So it becomes a hassle for patients, like I can do my skincare and that's as far as I can go, because having to apply all sorts of other stuff, it would be too complicated for me. Some patients use injectables, so like testosterone injectables like cypionate. I think that the problem with that is the half-life of testosterone. It gets consumed pretty fast. So, by the day number 5, you have to inject again. It's like an intramuscular shot. So it's like a long needle.
Oh my God.
So not a lot of patients want to be dealing with that every 5 days. It's like a lot. So pellets, it's an easy option. We do it in the office. It's fast. It's barely any pain, just from the lidocaine, and then you're done. You don't have to think about it. If you're a female, you do it every 4 months. If you're a male, you do it every 6 months, and then you forget about it. You don't have to worry about anything. And you feel amazing during that time. And then once the reinsertion time comes back, then you come in and we put the next cycle.
So why is the frequency of administering the pellets different for males and females?
Because of the amount of pellets that we put in. Okay. For males, we're putting 10 to 12 pellets. For females, it's maybe 2 to 3 pellets.
Okay.
So females have to come in more often. But I mean, they both feel great. I feel patients, it changes people's lives. Like I have patients that come in and they're like, I will not miss my pellet uh, appointment. Like I even I'm gonna tell you a story. Even during COVID, right? So we closed down. I was in Tampa back then. Nobody could open the clinic because you weren't essential. Our patients were going crazy. Like they would call me, like, I don't care if I have to go to your house. And at that point, then I started realizing, I mean, this is an essential part of life. You know,
Yeah.
I have to open the clinic to do insertions on these patients because they are starting to get depressed. They're starting to get anxious. They're feeling tired. So they're all the stress from everything that was going on it was they would call me like maniacs. I don't care if you have to come to my house. I'm like, I can't go to your house. Like it's like we're in a lockdown.
Yeah.
And at the end I started, kind of like I had like shields like in the hospital because I was still working at the ER at that point. So I would go with like my mask, my shield, and I would do insertions at the office because patients were like, no, I cannot live like this. That's
Wow.
how much it changes someone's lives.
Mm-hmm.
It's crazy.
That is so crazy.
Yeah.
Oh my goodness. So in terms of outside factors, like hidden outside factors that could affect your hormone levels, I think I've seen a lot that our diet is a huge part of that. As girls, there's a trend on TikTok. It's called girl dinner. Do you know what that is?
Girl dinner?
Girl dinner.
No.
So it's girls like combining the weirdest foods. I'm eating like chicken nuggets and like mac and cheese, like, and that's like my meal for the whole day. Or like they'll be like, oh, like I got my coffee, that's my breakfast. Like really just like
Oh, wow.
inadequate food choices for
Yeah.
like, for just like everyday living.
Yeah.
And I get a lot of girls like not just asking me, but like they'll be like, oh, like, so like what's your girl dinner today? My girl dinner is I just had coffee for the whole day. And it's like memes of like boyfriends checking on their girlfriends saying, you literally had coffee the whole day, like I need to get you food right now.
Wow.
So those little things that have been kind of glamorized like in the
Like good.
in the it's like a funny thing, but it's like that's not that funny because it's like affecting so much.
Yeah.
Of like not just how you feel but also how you look, like,
Right.
with hair loss and stuff. Like I didn't realize how much of a toll that actually took and how it snowballs because
Mhm.
once you start you can't stop. Like for me, I used to have coffee all the time and it made me feel like super anxious. And like I know a lot of people that they're like, they get jittery if they don't have it. It's like a
Uh-huh.
drug,
It
but
is a drug. Yeah.
it's like no, I mean your body's becoming so dependent on it.
Yeah.
And clearly that's affecting so many things such as your mood. And I mean, I feel so much more bloated when I have coffee than
Yeah.
like if I don't have coffee. So
I think caffeine has a lot of benefits, but everything to the extreme is bad, and
like
obviously you might not tolerate caffeine the same way I tolerate caffeine,
yeah.
so we can't. That's why for me, things that other people are doing, that doesn't mean you should be doing that.
Mm-hmm.
It's something where our bodies react in a certain way based on our genetics and our parents and the way they
And
that
that
doesn't
doesn't
mean
mean
that it we are going to react to it the same way. For example, diabetes,
oh yeah.
like some patients have genetics that stem back to their grandparents and their parents. And maybe for me, I shouldn't be eating sweets or I shouldn't be eating carbs, but my friends are doing it and I'm young and who cares? At this point, you don't think it's going to have repercussions later on in life,
Yeah.
which it also happens with hormones. That's a good example. For
Mm,
example, hair loss. There's so much hair loss going around. And I think between pollution, the world that we're living in,
the diet, how
everything
much
has preservatives
how
and
much stress
hormones,
we all have right now.
stress.
It's a stressful world we're living in,
It's
for real.
crazy. It's crazy.
I had like at the end of senior year of college, I had to get I didn't know this, but I went to the dermatologist and I had like a bald spot like on the back right here. And they gave me like a little, prescribed like ointment, but they put a Botox shot to stop the hair from like further the spot,
Expanding.
yes, from further expanding. But I mean, yeah, it's a stressful world. And I think we indulge in a lot of things that we shouldn't indulge in because it makes us feel better,
Of
or it's like,
course.
oh, like this is my guilty pleasure. But yeah, there are a lot more repercussions that go into that.
Yeah.
And it's like both spectrums too. Like you could either be like super fitness oriented, but if you're going to the gym every single day without rest, without proper
Yep.
meals, and all you're eating is like processed protein in a box or in a little
Yep.
like jug, it's like, no, that's not good either. So
Yeah.
keeping that balance is really
Yeah,
important.
I'll give you an example. For example, in medical school, when we're studying for like our tests, there's like an example of a female that's a runner and she's very athletic, and all of a sudden she loses her periods. And
I've seen
everyone
that.
associates, okay, she's at the gym, she's very athletic, she eats super healthy. Everything at extremes is bad. Even that point where if we are not the weight that we're supposed to be, or we're overexerting our bodies, it is going to affect some sort of hormone that's going to let you know, hey, you have to back off because this is not the way the body is supposed to function.
Mm-hmm. And then, so for, because, every single therapy has like a kind of like pros and cons. What would you say is the biggest side effects or risks that are associated when you are attempting to balance your hormones again? Because, like you said, there are some practitioners that they don't check and they're just like, oh, well, here you go. I mean, this will work. Like, depending on how much you weigh, how old you are, we're just basing it off of that and not actually checking like the true
The levels.
source of
Yeah, I
that.
think everything has, potential risks and benefits, right? If you don't go to a provider that knows what they're doing and they insert way too much hormone, then there's no way to remove the pellets and there's no way to back out of that. I had an example when I was an endocrinologist at Tampa General, where I had a patient that came in with palpitations, tremors. She was shaking, she was going crazy. She had a lot of anxiety, she had palpitations, she couldn't handle her daily life. And she didn't even associate the pellet insertion that somebody did back then with all these hormones, and she ended up having a testosterone level of like almost a man. It was like 700 and something. So at that
Oh
point I was
my
like, there's nothing
God.
I can do. You have to tough it up and wait this out because we cannot do anything.
How
so
long does that last?
so a level like that on a female can last you a good 6 to 8 months. So you have to make sure that you pick a provider that has done their research. They go to every year to learn new techniques. They know how to adjust the levels. I've had patients here, for example, at GLANZ that have told me, "Well, yeah, I did an insertion last year at whatever place, and they didn't even check my hormones." And I was like, "How did they measure
How
the
much you
levels
needed?
exactly? How many milligrams are you going to know what the patient needs?" No, they just put whatever in there. So part of us doing this podcast and teaching others and telling people, it's not just to sit here because we want to look pretty. We are pretty, but
That's a
we don't,
plus,
we don't
but
want to be famous.
yeah,
We do it because I honestly want to teach the patients that there's things that our other providers are doing that are
that
nuts.
blows my mind. Like,
Yes, so not everyone that calls themselves a provider, a doctor, or a nurse, or an NP, or all of those things means that they are performing medicine the way that it's supposed to. And
mhm.
this happens everywhere, even in
No,
the
yes.
hospital. So if you put way too much hormone, there's no way to take it out, and you're gonna have the same symptoms that you had before, but 10 times worse. So in my case, I base it because I'm an endocrinologist, I can see the calculations of the levels and decide kind of like, okay, in this person, I'm going to go a little bit lower. In this person, I think I can go a little bit higher. So a lot of my patients don't have abnormal symptoms because I'm used to just adjusting levels on and off. So, and because I've done it for so many years,
Yeah,
right? But that those would be side effects. You can
that's
have very
crazy.
bad side effects in terms of, for example, injections of testosterone. You males can, if they put way too much, you can make your blood more coagulable, so you're at risk of clotting. And those things, all of these things we talk to the patients when they come into the office. Um, but that's why pellets, if you do them safely and you do the right doses, your side effects should be none to maybe minimal, if so. You should have a very smooth ride, and you should have very well response with the dose and feel really, really good without having to experience the side effects.
For a first time injector for the pellets, is there like a learning phase that your body kind of adjusts, like, oh, I was down low here, but I'm going up here. But would you say that there's like a feeling of like your body's adjusting, or is it more so like a smooth, like you're saying it's like a seamless transition?
I think it's a seamless transition. I think patients, once they get the insertion done, by 2 to 3 weeks, they just notice that they feel more energetic, they have better libido, they can concentrate better. It's not something that you do that and flip a switch. It happens very nonchalantly, where you're like, oh, you know what? The last few days, like I had a patient, for example, tell me, this week I haven't had, like, I usually have 5 coffees during the day when I'm working. He's a doctor.
Yeah.
And he's like, I don't even need my coffees now. So it's not something that we're putting a wire and you're going to feel like Speedy Gonzalez or Energizer Buddy. It's not going to be like that. It's going to be very smooth, but you're going to definitely
Notice
see
a
the changes
difference.
and notice how your body's just acting better and recovering better from the gym and wanting to exercise more and do all those things. Another misconception, for example, is like, is this going to cause cancer? For example, if I replace estrogen on females, is this going to give me breast cancer? There was some medicines before in the past, like Premarin, where females were doing estrogen replacement therapy and they did have risks of cancer. In terms of pellet therapy, we're doing a hormonal therapy that involves estrogen, but it's a different type of estrogen. And in all the studies that they've done, because people think pellet therapy is new, but it's not, there's a lot of studies behind it and a lot of science. In all the studies, there hasn't been a case where a male develops prostate cancer or a female develops breast cancer or uterine cancer. There's nothing to prove that. That is a misconception and a myth. It's not correct. The science is behind hormone replacement, and it's behind this therapy, which I think has caused very, very good results for the patients, and it's giving patients a better quality of life for sure.
So, to kind of close that off, you would say that patients would start feeling positive effects or effects after 2 to 3 weeks of the administration. And then how long does that last? It would last until they would need to get hormone, another insertion.
Yes. Okay. So they're going to start feeling kind of like, oh, I'm kind of feeling tired now again. I need my pellets. Or like I said at the beginning, some people get moody or so, so those are you could patients that have pellets, they can feel that they need their next dose.
Okay.
When the time comes.
Wow.
Which is around 4 months for females and then 6 months for
males. So that was a great like general 360. I didn't even know that there were different types of hormones or hormone options.
Yeah, there's a lot of them, but to be honest, as the time goes by and more research is done regarding this topic, I think pellet is by far the best method of hormone replacement there is right now in the market. It's just hands down the best.
Would you say that we can literally talk about this all day, because I'm actually just so curious? Because to wrap it all up, we wanted to give you guys a motivational quote of the day. Dr. Rivera, what is the motivational quote today? Part. I know, I love it.
But I love the motivational quote of the day. For me, I went through a lot of changes, not only at work, but personal changes and relationship changes. So I found myself thinking about what I was missing and what I didn't have. And I don't want to get emotional, but
no, it's okay.
Instead of how blessed I am, right? Like we look at the world and I look outside and we live, in a free country and we have all this, resources and benefits that we get, and I have my family that supports me, and I have all these things that I started switching my mindset and saying, you know what, why am I thinking like this? Oh, why don't I have a house, or why don't I have this, or why am I missing this minor minuscule detail that it's really not important. So that's
Mm-hmm.
why I picked this quote, and it says, be thankful for what you have and you will end up having more. If you concentrate on what you don't have, you will never ever have enough. And I have lived through that. I've gone through divorce. I have gone through, selling a business, starting a whole new business. And that can take a toll on the way that we think. And I think for 2024, my resolution is to flip that mindset and say, you know what? Why am I thankful for instead of what do I not have? Because at
Mm-hmm.
the end of the day, like this quote says, if you are thankful for what you have, you're going to say, you know what, God, thank you for, I have more than I even deserve.
Mm-hmm.
As to where if I look at the other mindset, I'm never going to be happy, and I'm going to be disappointed in myself, and I'm going to be depressed. And I don't want to feel like that. So we are here in this earth with a purpose. We have a purpose from God, and we are here to help others. So for me to be able to do that, I have to have a mindset of being happy with everything that I have at the moment.
And
And
no,
if
nothing
we
is
get more,
perfect,
then better.
and nothing is
Exactly.
perfect at all. And I think that goes along with, our patients from everywhere that are looking for solutions like this. Nothing in life is ever perfect, but there's always a way to make it better. You can't feel hopeless, and, you know, optimism will always be in your favor at the end of the day. If you feel like it's going to change, it will change, and you don't need to really second guess about anything in terms of that. So, with that being said, I hope you guys have a wonderful rest of your day or night, whenever time you're watching this. And yeah, I hope to see you next week for our next episode.
Yeah.
Yeah.
If you guys have questions and you love this, please leave your questions below on our.
Mm-hmm.
I mean, it's on YouTube, so I'm not the most technological.
Yeah.
Leave the questions there. You can send us a DM through Instagram.
Email
Tell us
us.
what topics you want to learn about. Tell us
Mm-hmm.
what questions you have. If you're experiencing something that you think other people should know about, we are open to talking about anything. That's where we're doing this, and we're excited. Next week's episode is going to be amazing.
Yes. So, right. Thank you guys.